Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks. Today we explore the Editor's Picks for September 2023. Conversations around tattoos and melanoma diagnosis, Safety of Dipilumab in breastfeeding, a work of art with scars, and preventing tanning by oral antioxidant supplementation. But before we get into that,
get ready to experience cutting-edge science and innovation at the upcoming JEADV Congress in Berlin from the 11th to the 14th of October 2023. The JEADV Congress is one of the largest international gatherings dedicated to dermatology and venereology, providing a platform for the brightest minds in research, clinicians, and top industry professionals to come together, share knowledge, make connections, and foster scientific collaboration. Register by Wednesday the 6th of September for the last chance to save on your ticket. Visit eadvcongress2023.org for more information.
And now, Article 1. Conversations around tattoos and melanoma diagnosis. In this issue, we observe interesting conversations around the letter sent by Monfrecola and colleagues. As the authors contend, tattoos that cover large body surfaces, especially of a dark colour, can make self-examination impractical and therefore delay consulting a dermatologist and melanoma diagnosis. Figure 1 depicts the worrisome case presented by the authors involving a wide tattoo. Some risk factors, such as phototype, number of moles, and family history of melanoma, are elements that increase the need for more frequent dermatological screenings aiming for early diagnosis. Likewise, the authors argue that people with large tattoos should be considered at risk and encouraged to undergo more frequent dermatological checks than non-tattooed individuals. Rogowska et al. Commented that tattooing can lead to many diagnostic biases during skin examination, and that the most significant risk is misdiagnosing melanoma. They added that tattoos may lead to unnecessary excisions of benign lesions. Dr. Kluger also commented with rich experience as part of the EADV task force on tattoos and body art. The author acknowledged that even though association of melanoma and tattoos remains fortuitous, tattoos may theoretically mask a de novo melanoma and delay diagnosis. Despite this, stricter screening, especially of wide tattoos, is thus far unestablished. At-risk patients, for example familial melanoma or personal history of melanoma, numerous nevi or atypical mole syndrome, should be aware of these issues, and tattooists should be educated about not tattooing on any pre-existing pigmented lesion. Monfrecola et al. Subsequently pointed out areas of agreement with the comments and emphasized that self-inspection is more challenging with wide tattoos, which warrants clinical examination. Undoubtedly, this is a subject that sparks great interest among dermatologists and merits the expertise of the EADV task force to further address. Article 2. Safety of Dipilumab in breastfeeding. It is hypothesized that dupilumab, a human monoclonal IgG4 antibody used to treat moderate to severe atopic dermatitis, AD, may be safe during breastfeeding. However, data are lacking about its excretion into breast milk. Consequently, the European Task Force on Atopic Dermatitis, ETFAD, has warned against breastfeeding during treatment with dupilumab. In a case by Deckers et al., they describe a 30-year-old female who wanted to return to taking dupilumab 300 mg every other week for AD after a healthy delivery while aiming to breastfeed. Using liquid chromatography tandem mass spectrometry, they demonstrate that it is scarcely excreted into breast milk at approximately 1.3% of the maternal plasma dose. Given the low exposure level and sensitivity of immunoglobulins to digestion after oral intake of dupilumab via breast milk, the authors conclude it is unlikely that infants will have meaningful gastrointestinal and systemic exposure to dupilumab. Likewise, in another article, Escola et al. Describe one of the largest case series yet of patients with moderate to severe AD treated with dupilumab during pregnancy or breastfeeding, 11 and 2 patients respectively. There were no miscarriages or complications during pregnancy or puerperium, highlighting dupilumab's potential role in this subgroup of patients. Nevertheless, the authors recommend avoiding breastfeeding or use of dupilumab for 3 days postpartum due to the passage of immunoglobulins through gaps between the breast alveolar cells and in preterm infants who likely have an immature gastrointestinal tract. Article 3. A work of art with scars. The skin can be viewed as a canvas for a work of art, as shown in the images of tattoos. Others may see it as something to fix, hide, or be ashamed about. In a Historical Perspectives article by Lambertini et al., the authors describe the well-known representation of dermatologic diseases and other medical conditions in fine art. In a number of cases, many hypotheses have been proposed for the interpretation of the images, from representing signs and symptoms to displaying the side effects of medications, i.e. osteoporosis due to long-term corticosteroid use. They advocate that clinicians should contribute to improving the patient's self-esteem and acceptance of a disease, especially in chronic diseases, favouring a multidisciplinary approach including mental health therapists, for example psychologists and psychiatrists. Visual art has the power and the possibility to share this message, as done with examples of artwork by the artist Tamsin Van Essen, through exhibitions or social networks, especially in a time where physical beauty is a goal for many. Article 4. Preventing tanning by oral antioxidant supplementation. Traffic-related air pollution leads to hyperpigmentation of human skin. This tanning response is mediated by oxidative stress, and it can be reduced by the topical application of antioxidants. Greta Beck and colleagues carried out a randomized double-blind placebo-controlled in vivo study in 60 healthy volunteers using the Dusseldorf pollution patch test to elicit tanning responses. They showed that similar to topical antioxidants, regular intake of an antioxidant-rich oral supplement for periods of up to 12 weeks can prevent air pollution-induced tanning of human skin. Advantages include the easier mode of application and more homogeneous skin protection. The authors transparently note that skin tanning responses were likely due to the antioxidant activity of the actives present in the test product, but that the study design does not allow for confirmation of which active is the most relevant or if any property of the active ingredients may have contributed to this effect. Thus, the authors emphasize that nutritional supplements not only help protect human skin against UVB and UVA radiation, but also against traffic-related air pollution. Our first article was Could Wide Tattoo Delay the Early Diagnosis of Cutaneous Melanoma? By Monfrecola and co-authors. Our second article was Limited Excretion of Dupilumab into Breast Milk, a Case Report by Deckers and co-authors. Our third article was The Value of Art in Modern Dermatology and Medicine by Lambertini and co-authors. Our fourth article was Assessment of the Protective Effect against Air Pollution-Induced Skin Pigmentation of an Oral Nutritional Supplement Containing Antioxidants, a randomized, double-blinded, placebo-controlled study by Marini and co-authors. Of course, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and though you can find free access and open access articles, EADV members benefit greatly by having access to all articles and content.
Before you go, a quick favor. If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode. Thank you for your support. It means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.